Thank you, Anna. I am going to share my slides, so please give me a moment. I just to make sure that everyone could see my slide and you, okay, I got a thumbs up from Anna. So thank you for that thumbs up and confirming that you could see my slide. So welcome to the data bearing presentation entitled Population Assessment of Tobacco and Health Study. Data overview, history, and available resources. We are so glad to have you with us today, and we hope that you find this presentation helpful. As a quick note for you all, at least a few of you might have already seen from my presentation on Tuesday that I am profoundly deaf and aware that I have a deaf accent. So for this presentation, please feel free to let us know or send a chat to us if you need us to slow down or repeat something. We want to ensure that you can understand what is being presented to you so that you feel included and able to follow along to enjoy our presentation. And again, we can answer your questions afterward if they are not pressing. And now let's have us start by reviewing the data that we will cover during our presentation. The first section of our presentation will be the introduction to the PATH study. And we will talk about ICPSR NADAP staff, the collaboration that happened with the PATH study and NADAP, data products and users, accessing the data, and PATH study and research. And then the next section of our presentation will be about the available resources that the PATH study has to offer. In that section, we will briefly touch detailed about the workshop, webinar, conference, short courses, PATH study video, the data table, the figure, and the PATH study data form. And next, we will do a quick plug-in for NADAP social media. And now that we've gone over the outline, let's get started with the introductions to the PATH study. And we should introduce ourselves. So, hello, my name is Alison Sweet, and I am a Senior Data Project Manager working on the PATH study. My co-presenter today is Michael Kirkwood, who is a Data Project Manager also working on the PATH study. Generally, I oversee the PATH study work with support from project leadership, and I manage project administration and help to ensure that the deliverables are met through collaboration between NADAP staff and stakeholders. Michael leads the data management and creation workflow efforts on the PATH study and the data release coordination with stakeholders. And then we will meet the rest of the team on the next slide. On this slide, you can see AVP at the NADAP director and Joy sharing the co-director. But we consider both Amy and Joy to be PATH study leadership like they are NADAP leadership. As Chelsea Sample Steele and Sean Cochran likely noted in their NADAP presentation earlier, Amy and Joy provide such extraordinary and integral leadership for NADAP and therefore the PATH study. They have been incredibly helpful in ensuring that NADAP staff, including the ones working at the PATH study, have the support and tools that they need to complete our deliverable. So thank you for that. And next, we have Alicia Patel and Sarah Schaefer, who we recently welcomed to ICPSR and our team. Alicia is the PATH study data manager who works nicely with Michael to complete the PATH study data releases and help with the coordination of the release detail. And Sarah is the PATH study project assistant who is managing the research data application for the PATH study, user support inquiry, and other project support. And then you'll now learn more about the PATH study data with Michael taking over for a while. So Michael, the floor is now yours. As soon as I stop sharing my screen.
Sure. Let's see. Jam. Okay. Can we all see my slides? Great. Okay. Okay. Thank you, Allison, for the introduction. Hello, everyone, and welcome to the PATH study presentation on behalf of ICPSR's Data Fair. My name is Michael Kirkwood, and as previously noted, I'm a data project manager for the PATH study. The PATH study is a collaboration between the National Institute on Drug Abuse, or NIDA, through the National Institute of Health. It is also in conjunction with the Center for Tobacco Products and the Food and Drug Administration. Briefly, the PATH study is an ongoing longitudinal cohort study on tobacco use behavior, attitudes and beliefs, and tobacco-related health outcomes in the United States. The first wave of PATH data was collected in 2013 with annual waves and data sets added frequently. Questionnaire data are collected from adults and youth parent national samples, as well as biomarker data, which is drawn from urine and blood samples. And those are also collected from the participants. So let's talk about NADAP, how the PATH study fits within the archive's mission. NADAP, National Addiction and HIV Data Archive Program here at ICPSR. Our mission is to support the drug addiction research community by acquiring, preserving, and disseminating data relevant to drug addiction and HIV research, as well as to support secondary analysis, technical assistance, and specialized training for researchers. NADAP's role with the PATH study is to closely work with NIDA, the FDA, and Westat, which is a data collection firm, to curate and disseminate the PATH study data for secondary analysis through data access and centralized availability. In addition to the addictive nature of tobacco, and given that the study is a longitudinal sample of both youth and early adulthood, the PATH study data complements NADAP's mission directly through tracking attitudes and self-reports of street drug use, the abuse of prescription medication, and provides insights into various aspects of current social norms and behaviors. Just some items of note about the PATH study. The PATH study is one of the most accessed data collections within NADAP. While the first wave of PATH data was collected in 2013, the data have been available to researchers in both public and restricted versions beginning in late 2015. The PATH collection now consists of 6 major data products, each with numerous data sets. In addition to data sets, NADAP also disseminates weights files, documentation such as user guides and questionnaires for both public and restricted use, as well as tobacco unique product code data sets or state identification data sets for restricted use research. Here we can get an idea of just how extensive the PATH study is. The restricted use files, also known as the RUF, consists of data from adult interviews, youth and parent interviews, and biospecimen collection across waves. The RUF currently consists of 49 data sets with over 22,000 variables. Work on restricted use files for the PATH study is done via the Virtual Data Mutual Data Enclave, otherwise called the VDE, which is a computing environment that prevents data from being compromised. Similarly, the PUF, or public use files, are the same wave data in sample, but with potentially disclosive identifiers either top-coded, recoded, or removed to meet both federal and ICPSR standards of public use data. As you can see, the PUF isn't much smaller and features 32 data sets with nearly 20,000 variables. These data sets are truly public and can be accessed and downloaded by anyone. That means students, individual researchers, etc. There are also respective special collections waves, both restricted use and public use, that are collected at 6-month intervals between the PATH study's regular waves. This is done to be able to track trends more closely, such as the recent examination of vape sales and use in American youth, which led to restriction legislation and closer oversight. The special collections also provided space to continue PATH research during the COVID-19 pandemic by modifying the data collection method to include an adult telephone survey. And items appear in the adult telephone survey outlining the sample population's experiences with COVID-19. NADAP will be updating the special collections public use files this fall. So please do keep an eye out for those. Additionally, there are biomarker restricted files, which, as previously mentioned, are blood and urine samples voluntarily collected from the adult sample at wave 1, who provide samples annually. The data from the assays are linked via participant identification number in order to track variance in the samples along with reported tobacco use. These participant identification numbers are the main feature of our master linkage files. Don't let the 2 data sets and low variables fool you. The master linkage file indicates whether a participant's data, did I skip there? I'm sorry. No, I didn't. Okay. Don't let the two small data sets in the master linkage files fool you. Master linkage file indicates whether a participant's data is present in individual data sets for each wave. Anytime we add a data set, the master linkage file is updated. So it is a great place to begin for both public use and restricted use researchers. With that, we can take a look at some usage visualizations. So as you can see, the PUF has over 1,000 unique users with 1,696 sessions, including the download of a data set or documentation. The RUF, which requires approved restricted data use applications to use, is close with 849 users to date, with 1,355 sessions, including the download of documentation only. Again, that happens that work occurs in the VDE, so we don't anticipate downloads there. VRUF is somewhat specialized data, so the lower number of users and downloads is to be expected. And the special collections, both restricted and public, are fairly new additions. They only have a wave or two at the time these usage stats were generated. As noted, we do have some updates that are coming first week of October to the special collections files. At this point, you may be wondering, how do I gain access to all of these wonderful data? As a first step, NADAP would like to invite any and all interested researchers to check out the Path Study series page. This can be accessed via a link posted in the slides that are available with the presentation. Here you will find comprehensive detail and documentation about the Path Study, including sampling information, methodology, more information about which data sets you may wish to pursue or may wish to use in the pursuit of your own research questions. For those interested in public use data, remember that those data are available to anyone through direct download from each study homepage. One of the fastest ways to download the public use data is by selecting the download button that's near the top of the page or near the top of the study homepage. To use the public use data, you must agree to the ICPSR terms of use and log into or create a My Data account. Please note that public use data is readily available for all major stats packages and that data is free to use. For restricted use data, researchers will need to apply for access to the data in ICPSR's Virtual Data Enclave, or VDE. To begin the application process, data users need to select the Access Restricted Data button near the top of the page. A pop-up modal box with instructions will appear and give you the opportunity to check out NADAP's VDE guide and then start the application. It is important that it is important to note here that all Path Study data, public use or restricted use, is free. It's free of charge to anyone. Oops. Sorry about that. Before you do begin to submit your application for restricted data, NADAP recommends the following. You review the data documentation for variables to ensure they are pertinent to your research question, that you read details of restrictions on the study homepage, and consult the VDE guide. We also have a few things to keep in mind. Applications for restricted use Path Study data are typically approved within 5 to 7 business days. Significant updates or corrections to application materials may extend this timeline, and each research team can have up to 20 collaborators. Let's see. So the Path Study truly is a great resource for the addiction research community. As of September 1st, 2022, there have been 552 journal articles published using Path data, well over 300 presentations, and nearly 40 theses. This next slide is an indication of what studies are cited the most among those publications. Here we can see that the citation of public use files, which are available for anyone to use right now, is nearly double that of the citation of restricted use data. NADAP is extremely proud of the popularity of this study and all of the subsequent contributions to the social science and addiction research communities made by researchers using this data. We thank you for your interest and look forward to helping the research community expand these publications in the years to come. With that, I'm going to turn it back over to Allison. So I'm going to stop sharing my screen.
Thank you, Michael. I am getting ready to share my screen, so please give me just a moment. And how are we looking here with my screen sharing? Thumbs up. Thank you so much. All right. And I just want to say thank you to Michael, as that was such a great introduction to the PATH study. And now we can go ahead and start to check out some of the available resources that the PATH study has to offer to the research community. So just as we do in disseminating data, we collaborate with NIDA, the FDA, and RESTA to help produce webinars about the PATH study, host virtual or hybrid workshops, and provide additional educational resources. And we want to add that we think it is helpful to know that the PATH study webinar recording and educational resources, such as the featured data table, data user form, and any additional presentation recordings are available on the PATH study series page, as you saw earlier in the presentation, as well as the NADA website. So there are multiple avenues for you and data users to access the resources. And we are excited to share that NADA and our collaborators plan to host a PATH study workshop in summer 2023. So please check back for announcement in late winter or early spring of 2023. In the meantime, we definitely encourage you to check out the syllabi for the previous workshop at the NADA website. As we continue to talk about the educational resources that we have, I want to put you to the PATH Study 101 and 102 videos. The PATH Study 101 video was developed in 2019 and provides a really nice and thorough introduction to the design and content of waves 1 through 3 of the PATH study. We recommend this video first for researchers or data users who are brand new to the PATH study and want to learn more about the first 3 waves through the video. Then we have the PATH Study 102 video that was developed in 2021. The PATH Study 102 video gives viewers an overview of how to locate and access the public and research the PATH Study data products. As well, there's also a brief section that offers information about the PATH Study, biospecimen access program, and related resources. So this video, the PATH Study 102, is super helpful for folks who just want to better understand how to access the data and what the biospecimen access program is. These videos are available on the PATH Study series page and has its own playlist on ICPSR YouTube channel. So feel free to check them out at your own leisure. And next, we have a newer resource that NADA and our collaborators work together to make publicly available for the data user community. Please check out the PATH Study data table figure. They are a series of cross-sectional and longitudinal tables and figures from the PATH Study data. These items provide information about tobacco use among 3 different age groups, like youth, young adults, and adults. There are over 100 PDF files for everyone to check out, and they are available via the link on the slide. Please feel free to explore them, and it is also really fun to check out the web pages too. So on the next slide, this is an example of one of the PDF files that contains some statistics. Again, we have lots of these items available for data users, and they are provided in a way that is easy to navigate and easy to understand for people who are also novice users. So, and another very helpful note for you all is that we have citation templates available for the data users as well. And they're just so that anyone who wants to reference a specific PDF file in their written works. If you do plan to use one of those PDF files, please be sure to use the citation provided on the slide and on each one of those PDF files. And they're just really just helpful for people to be able to use it without having to dig into all the specific details. So we have a template ready for you all. And as well, you could share that information, let others know about that citation template. And last but not least, another educational resource for data users is the PATH Study Data User Forum. Generally, data users can go on this platform to learn about the PATH Study development and releases. Data users can submit their questions or comments to interact with other data users to get tips or feedback on their analysis. It is a great way to engage and collaborate with other data users as well as our staff at the end. It is also a nice way to share your publication and presentation. And now we want to do a quick plug-in for NetUp social media. NetUp, as you know, have a Facebook and Twitter account, so please feel free to connect with us, become our fan, and follow us. You can expect regular posts about upcoming events, new data releases, publication, or related news from NetUp. And that concludes our presentation. So thank you all for your time and for watching our presentation, and we hope you found it informative. We are happy to take any questions now if you haven't already sent any. And I need to stop sharing my screen so that you can see all of our faces. I see a question. This question is probably good for Michael. Michael, could you give a quick overview of major variables other than the biospecimen that are in the research and use file, but not in the public use file?
Well, the major difference between those are specifics and also the files that are available. So the tobacco unique product identifier data set is available to restricted use users. That gets very specific about which product is being used. So in the PATH study, participants are encouraged to bring any tobacco products that they use. So they would bring their vapes, they would bring nicotine lozenges, they would bring other things like that. And those UPCs are actually scanned so that people can track, which products would be more effective in cessation, which products are harder to get away from over time, those sorts of things. So that's what's available in the restricted use files. That's really not available to the public. There's also things such as age demographics, there's locations, there's just standard identifiers that are, they're available for restricted use data users, but may not be the best to just publicly disseminate right away. Hope that answers the question.
I think you did. And I wanted to mention that when you say locations, you mean state identifier data, correct?
That's correct, yes. No, it doesn't get any more granular than state for any user. That's just part of the design. So.
Okay, I think we don't have any other questions right now. And I see a message from Anna. Okay, I think unless there's anything else that we want to cover here, Michael, I think we could go ahead and close up the presentation. So Michael, did you want anything to add?
No, I think we have a raised hand.
A raised hand?
Yes.
I did not see that. Thank you.
Yes.
I don't see any raised hands. Was it possibly a reaction that you saw?
I believe it was a raised hand, but it's gone now. So we'll close this out.
Did you see a copy of now?
Chance. I see. Yeah, no, I see waves now, or I see the waves now. But
clapping.
No, I think we can close out and just please, to anyone that's viewing this, to join us for the next presentation, which is the introduction to the patient-centered outcomes data repository, or PCODER, as we call it around here. But yeah, thank you everyone for attending, and have a great rest of your day. Thank you for coming to the data fair.
Thank you all. Take care.